Now, to understand, you talk about, reversing uh, uh, hair loss naturally. If from a general perspective, normally people think, this hair loss cannot be reversed. What makes you so confident about, that one can reverse this, and that too naturally? What is the basis? Help us understand your thought on this, and how can those people who trust your method can go for this?
Sure. Well, first and foremost, I would be of disservice if I didn't point everyone to my testimonials page on my website because there's a lot of videos and screenshots of phone conversations and images that can help inspire people. My own story is there as well, right? So people can see the transformation in my own story. But here's the common misconception, right? Or the what people need to be rewired to believe. When you go to the doctor is just trying to manage the hair loss symptoms. So minoxidil is a drug that is made to help. And the injections, the PRP injections, that's when they take your own plasma and they inject it into your skull. That was made to help. The transplant where they take hair from the back and they put it to the front. And that was all made to help. So what is that doing? It is increasing the amount of blood flow to your head when you put a minoxidil on. It is increasing the amount of blood flow to your head when you are doing the PRP. The transplant, obviously, you're moving hair there. So none of that is focusing on the root cause. It's all giving you a superficial result. And it's putting you in a situation where you have to do that ongoing to address the issue. But that's all they have. They also gave me a medication at one point called spironolactone, which it helped to slow down the progression. And it does that by suppressing DHT, which is a true form of testosterone. So it did work to a certain extent, but it didn't help the hair I had already lost grow back. Why? Because I had scar tissue that wasn't being dissolved. And when it came to DHT, the reason my body was creating more DHT was because I was inflamed. I had low grade inflammation from leaky gut, from mold toxicity, overexposure to toxicants. And because I was constantly inflamed, my genetic superpower is to create DHT because that is a form of testosterone that will not down into anything else. And testosterone helps modulate inflammation. So that's literally my genetic superpower to help me deal with the low grade chronic inflammation. So now that's what is available in medicine where they say there's nothing we can do. All we can do is slow it down. Come over to functional medicine. Okay. When we work on healing the gut, what we're doing is making sure that your blood is going to get the nutrients from what you eat. I'm also encouraging my clients to stay away from sugar, gluten, dairy, corn, and rice. Most people are not doing that. Those are high inflammatory foods. That right there can be keeping you chronically inflamed. And I cannot tell you how many times clients that sign up with me do just that. That's all they do is clean up their diet to that degree, and all of a sudden it's like my hair's not falling out as much, my rings fit better, my hands aren't swollen, my face isn't swollen, all these different things start to happen. I'm not constipated anymore just from cleaning up the diet to that degree. And so when we work functionally to make sure the gut is healed, we're helping your body's ability to detox, we're helping your body's ability to actually get nutrients to the hair. And, when we're working on the blood sugar balance and the inflammation, we are stopping excess scar tissue from forming. So the problem isn't going to get worse. What it is that is causing that pattern of hair to start thinning is actually, whether you have a diagnosis or not, it can be calcifications, which is when you're living a very acidic lifestyle and your body leaches calcium from your bone or your teeth. Hello, cavities, to make your blood more alkaline, and then it can deposit what's left over on your scalp. Or it could be a low-grade consistent infection in your scalp, maybe candida overgrowth or whatever the case is, and you're not clearing it because you keep eating the sugar, so then your body will make scar tissue. Even if it's not sugar, it could be too many carbs or whatever the case is. And you're feeding the fungal overgrowth, and the scalp is in a perfect place for that to grow. Once you can't push the toxins out through your scalp, it just is like a living infection. And then you don't have to have symptoms of you have a lot of dandruff or your scalp is itching, though that's very common. It could be underneath, right? Because it's not getting out of the scalp. And so your body will try to create scar tissue to isolate that infection that you're not isolating on your own. And those are just one of a few examples, but there are many, 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 many examples of what's happening. So in functional medicine, the reason why the success rate is so high is because we are taking a deep dive into each specific client. For some people, it was their hair was fine, and then they all of a sudden got COVID or they got the vaccine, and the massive amounts of hair were falling out. And in that person, it just meant that the amount of toxicants they were exposed to, it was so high that their body started creating symptoms at that point. But they had other things leading up to that was setting the stage for that one trigger to create the problem. We all have this invisible line called the allostatic load, and this is the line at which our body can tolerate toxicants and not develop symptoms, like when we were teenagers, right? But what happens as we get older, we're storing toxicants, we're getting exposed to so many of them, they're coming in faster than we can get them out. So we surpass that allostatic load. Now we're living in the area of creating autoimmune conditions as we get older. Now we're living in the area of creating developing genetic traits like hair loss or high blood pressure or diabetes as we get older, because we're in that area of our body can't keep up with the toxicants that we're exposing ourselves to. And now our body has to compensate for that genetically. Um, but the way it's doing that is causing these symptoms. And we don't realize that the true root cause are these things that we're not taught to look for. We're taught just to go for the symptom. And that's why there's so many complications in regular medicine, because I worked there for 10 years. I had a front row seat. I worked for specialty pharmacies for 10 years. So I had a front row seat of people coming into the doctor's office, getting put on a medication to resolve the symptom. That medication gave them 10 more symptoms. Then they got to put on a medication to address that symptom. And then that's because it's a symptom-based approach instead of a root cause approach. When you look at the root cause, you're looking at absolutely every single factor that's contributing to it, and you're addressing all of them at the same time. And so the results can compound, and they can be noticeable and dramatic quickly.
Right, right. Thank you for that, Serial. And I'm sure a lot of people, uh, will want to. There's so much to learn from you, and I'm sure a lot of people would want to learn more about you, from you, about all these things, and especially about, hair loss, so that because it is such a very important thing in our lives, especially for women, and I'm sure. So, what is the best way that they can connect with you, learn about all the things that you are teaching, about your program? What's the best way to do so?
Oh, well, thank you for asking. They can certainly go to my website, which is belcanics.com, BELLECHANICS.com. But they can also find me on Facebook. I have a Facebook group called Reversing Hair Loss Naturally, and I answer community questions in there once a week. And that seems to be very helpful to the women in there. But if they take the quiz on my website, at the end of the quiz, they do have an opportunity to book a consult with me. So that would be the quickest way for them to have a one-on-one conversation with me about their specific circumstance with their hair and what could be done functionally to help reverse it.